Let me present to you our next speakers. Dr. U.Suprun, Director of Humanitarian Initiatives, Ukraine World Congress, K.Waler, Canada-Ukraine Foundation, A.Myrgorodsky and Oksana Sivak, NGO Initiative A+, and N.Golembievska, Ukrainian Association of Specialists in Overcoming the Consequences of Traumatic Events. Шановні колеги, дозвольте представити вам.
Esteemed colleagues, allow me to introduce our speakers, U.Suprun, Director of Humanitarian Initiatives, Ukrainian World Congress, K.Waler, Canada-Ukraine Foundation, A.Myrgorodsky and Oksana Sivak, NGO Initiative E+, and N.Golembievska, NGO Ukrainian Association of Specialists in Overcoming the Consequences of Traumatic Events. Thank you.
I'm U.Suprun, Director of the Humanitarian Initiatives for the Ukrainian World Congress, the international coordinating body for Ukrainian communities in the diaspora, representing the interests of over 20 million Ukrainians. The UWC has member organizations in 33 countries and ties with Ukrainians in 14 additional countries. Founded in 1967, the UWC was recognized in 2003 by the United Nations Economic and Social Council as a non-governmental organization with special consultative status. The UWC has actively engaged in humanitarian aid for Ukraine during the recent events surrounding the Euromaidan and afterwards, cooperating with both local Ukrainian partners and international humanitarian aid organizations. Among other projects, we provide equipment and supplies to the Red Cross mobile brigades who travel to those regions where civilians may be injured during conflict situations. As Director of Humanitarian Initiatives for the UWC, I was outraged at the brazen attack by pro-Russian separatists on the Red Cross office in Donetsk on May 9th, and at the kidnapping and beating of 7 members of the Red Cross. The looting of the first aid supplies meant for injured civilians is unconscionable. The Red Cross brigades are nonpartisan, providing aid to anyone who's injured, regardless of who they are or on what side they stand. The wanton disregard for internationally accepted rules of conduct and the disrespect for those who are simply trying to save lives reflects let me repeat that. The Red Cross brigades are protected by the Geneva Convention, and the attack on the office by the separatists reflects their wanton disregard for internationally accepted rules of conduct and their disrespect for those who are simply trying to save lives. Since the attack, the Red Cross has been forced to close their office in Donetsk. With this closure, the aid that the UWC has allocated for their efforts is under review. If and when the Red Cross office in Donetsk resumes its operations, we'll continue our cooperation with the brave medics in the city. We'll continue to supply the Red Cross brigades in other cities as well, supporting the vital work they do in providing the life-saving first aid to those who are injured. In addition, we have received a shipment of materials from the United States for the Red Cross brigades. That shipment is being held up in the FedEx office in Kyiv because of problems with certification of certain equipment in Ukraine. One of those pieces of equipment that cannot be certified is this, which is a combat tourniquet. As you see, it's a very innocent piece of equipment. It's something that could save lives. At this time, we're having discussions with the Ministry of Health in trying to get these types of items through the customs procedures in a much quicker manner so that we don't have to wait to save people's lives because of bureaucratic difficulties. For your information, 2 members of the Ukrainian Red Cross are here in the audience, and if anybody would like to speak to them afterwards, they'll be able to answer more of your questions, give you more details about the attacks that happened in Donetsk over the weekend. The UWC has also completed several other projects, including partnering with the Canada-Ukraine Foundation in delivering a ventilator to the Donetsk Trauma Hospital, and facilitating the work of a team of physicians from Canada who are in Ukraine to assess the needs of those injured during the events surrounding Maidan. Future projects proposed by the assessment team will be presented to you in a few minutes by K.Waler from the Canada-Ukraine Foundation. The violence surrounding Euromaidan and subsequent Russian aggression against Ukraine has caused psychological injuries, both obvious and hidden. Witnesses to these events have developed acute stress symptoms which can progress to become chronic post-traumatic stress disorders. Together with the United Ukrainian American Relief Committee and with the support of the U.S. Embassy in Ukraine, the UWC is organizing a series of training seminars by 5 world-renowned disaster psychological relief specialists from the United States. They'll provide training sessions for psychologists and psychiatrists in Ukraine on post-traumatic stress disorder prevention and treatment. Similar seminars have already taken place in Pushta Voditsa here in Kyiv in partnership with Caritas Ukraine. The UWC and CUF have been working with the Maidan Psychological Service in Kyiv and Lviv, establishing rehabilitation centers for those who require further care, both medical and psychological. Mobile brigades of psychologists are traveling to those areas where Ukrainian Army and National Guard soldiers are deployed. By providing psychological first aid and intervention for the soldiers, they hope to prevent long-term post-traumatic stress disorders from developing. N.Golembievska from the Psychological Service of Maidan, which has recently transformed into a new organization named the Ukrainian Association of Overcoming the Consequences of Traumatic Events, will discuss the association's current and future projects. The UWC is also working closely with Initiative E+, a Ukrainian civic organization which is comprised of volunteers who help to transport the injured from Maidan to safety by taking them to churches where makeshift hospitals were set up, and later to Poland, Latvia, Lithuania, Germany, Austria, and other countries for treatment. The organization is building a database of those injured during Euromaidan, which will then be made available to the Ukrainian Ministry of Health and other international organizations. A.Myrgorodsky of E+ will tell you more about the history of the organization and their projects. The Ukrainian World Congress will continue to provide humanitarian aid to all Ukrainians who need our help. We hope that our projects in Donetsk, specifically supplying the Red Cross office there with life-saving equipment, will be able to be resumed shortly. We'll continue to monitor the situation there and respond to questions on the ground accordingly. Next, I would like to introduce from the Canada-Ukraine Foundation, K.Waler. Thank you.
Good afternoon, everyone. The Canada-Ukraine Foundation, along with the Ukrainian Canadian Congress and the Diaspora of Canada, has come together to provide medical and humanitarian assistance to the people of Ukraine in this time. In April, the Canada-Ukraine Foundation sent a team of medical professionals after a recommendation from the Ministry of Foreign Affairs of Canada under the direction of Minister John Baird, who himself has traveled to Ukraine 3 times since November. We were looking to assess how we as a diaspora could best help people in this difficult time. With the guidance and help of Initiative E+, the civic organization Uliana mentioned, we traveled to Kyiv, Lviv, and Donetsk. We met with key government officials in each oblast. And after 10 days of meeting with people from different organizations and institutions, one of our first initiatives was to provide the Donetsk Trauma Hospital with a ventilator for their ICU. We'd like to thank the government, the Oblast administration in Donetsk for all their help in facilitating this, and we hope to continue our cooperation with this institution in the future. We also met with the first responders from the Red Cross who helped prepare them to provide aid to those injured in clashes all over the country. In the future, we will be returning with a team of doctors to perform reconstructive surgeries to those who have incurred craniofacial deformities of extremities, or amputations of extremities. We will be working alongside doctors from Ukraine together to make sure that these people get the best treatment possible. The Canada-Ukraine Foundation is also facilitating the post-traumatic stress psychological treatment of patients with local psychologists and psychiatrists. We will continue to work closely with everybody in Ukraine, with government officials, and provide people of Ukraine with medical and humanitarian assistance that they require in this time. Thank you.
Next, N.Golembievska from the Psychological Service of Maidan will give a presentation in Ukrainian.
The psychological service is known as the community of the volunteers. These are the experts on the therapy which provide assistance according to the international standards. The service is headed by Vladimir Pogorel, the psychotherapist. Most of the participants have already the post-traumatic problems, and because of the negative effects suffer. It's not just them who suffer, but all those who are close by. And in relation with the continuation of overcoming the consequences of traumatic events, we created this Ukrainian Association on Specialists in Overcoming the Consequences of Traumatic Events. With the help of the Canada-Ukraine Community Foundation and Ukrainian World Congress, on the 24th, 27th of April, we had the round table in Vorokta as to the creation of the rehabilitation centers to work with the post-traumatic syndrome. The project of rehabilitation of those who were wounded includes the work with the those who suffered because of the tortures, with the wounded, and with the families of those who perished. Also, the groups of rapid response were organized. This project is at the stage of active implementation because our volunteers are already in the zone of conflict, and they provide the initial primary assistance and psychological assistance. Also, we work together with the American Committee from the 5th to 7th of May in Pushavoditsa together with Caritas Ukraine. For our specialists, there was a qualification training organized of reducing the impact of crisis situations. The training was conducted by Blue Angels NGO from Slovakia. In May, in Lviv and in Kiev, there will be practical workshops of the project of anti-stress assistance to Maidan with the assistance of Bruce Ayon, the sociologist. He will report on similar programs in the U.S., and Francis Abega, the psychologist who specializes in these issues. He has an experience of work with the military who participated in crisis operations. We also plan to have some meetings in the Ministry of Public Health. Also, our Ukrainian Association is sure that in the result of our cooperation with the World Congress of Ukrainians will help us to render assistance to our people. Thank you. Это невозможно. Now there will be questions. A big request to everyone who speaks, especially in English, please speak slower. Ukrainian. And A.Myrgorodsky and Oksana Sivak from Initiative Plus, and after that there will be questions.
21 січня 2014 року ми заснували волонтерську ініціативу, яку назвали «Безпечне транспортування». Суть полягала в тому, щоб знаходити на Майдані хворих, постраждалих людей та вивозити їх поза офіційної медицини, тому що в лікарнях їх могли заарештувати фактично. Таким чином ми домовилися з 4 монастирями і церквами і вивезли понад 300 осіб з 21 січня по 24 лютого. Потім ми вивозили людей до аеропортів, коли вони їхали на лікування за кордон. Близько 200 людей було вивезено на наших приватних автомобілях, а також на швидких, які ми організували. Завдяки цій всій ініціативі, яку робили ми під час подій на Майдані, у нас зібралася серйозна фактологічна інформація про постраждалих на Майдані. Таким чином, ми зрозуміли, що цю інформацію треба вкласти в якусь базу даних, яка залишиться для історії, яка буде використана міністерствами і...
For history, and which will be used by NGOs that assist the victims. We developed the procedure where they fill in the form about the violations, and this is submitted to, that is the application about the crime, which is submitted to the General Prosecutor's Office. And also we have the questionnaire of Initiative V+, where the victim fills in all the details about himself, herself, about the family, about the medical assistance received. We have all the passport data and everything. We accumulated a lot of data with the assistance of which we will be able to verify the victims at Maidan. This will be the unified database which will be used by both the private donors and officials who would like to provide assistance, but they don't know to who and which, and we have all the figures, the amounts, who provided assistance and so on. We have already 130 verified persons, those who personally came to our office. We believe that there are more than 600 of such people. After we have 200, 250, we will move from Kiev to regions of Ukraine. We will be appointing meetings at the hospitals and at the offices in regional centers.
Now I would like to give the floor to my colleague, Ms. Oksana Sevak, who is responsible for the medical area of our initiative, medical part, and who assisted very much in Maidan, and who is now looking for the best ways how to treat those people who are wounded and harmed. Good afternoon. Working on Maidan, we started our work unofficially, so to say, on the ground. We cooperated very much with the drivers, with other doctors. Actually, we were about 30 people. Now we are united in this initiative E+. These are quite different people of different occupations, from different backgrounds. These are businessmen, social workers, teachers, who actually came to this organization by the call of their heart, and our major objective is to assist those people who suffered. Our major objective is to verify the personal data, diagnosis, and the medical story of those people who suffered, and now we meet those whom we transported for treatment to Poland, to Germany. Now they come back. They are registered in our database number 1, which is called the Maidan. Unfortunately, the military actions continue, and there are victims and those who suffered in result of these military actions. That's why we plan to visit Odessa, Lviv, other regions. We have volunteers working in different cities of Ukraine. We know them from our joint operations on Maidan, and they also feel complete card, complete information about each patient, and on the other side, we have a lot of potential sponsors who want to help personally to those who suffered on Maidan or in result of military actions. There are many people willing to pay directly to families of the victims, and there are many people who suffered in result of those events. Many people were treated abroad, and some of them will require secondary and tertiary treatment in 6 months, in a year, and those who came back after treatment in Germany, for example, they should be registered and followed up. And this is another our objective, to register these people and to find follow-up funding for this continuous treatment. And we expect that you also would join to this effort. But the access to this database for us and for potential sponsors will be opened first, and later on we plan to open access for this database also for broad public to know those people who stand for the dignity of the state. Also, we have a database of those doctors who worked unofficially in underground, and another my responsibility is to select the best experts in different medical fields. For example, when we have very difficult cases, and we are able to advise, to provide a patient with advice where to go. For example, the transplantation of this retina, for example, we advise to go abroad. We have the full list of such clinics or hospitals, and having the full estimate of necessary expenses and costs, we may apply to foundations which may sponsor such treatment. No, we have started this procedure already, although we cannot say that this is a very quick process, but nevertheless we are improving, we are trying to improve this procedure all the time.
I would like to give you the hotline number, points 067 407 and so on and so on. If you have any questions, you're welcome. Yeah, we do have questions. Briefly, it's about the Red Cross. How much there will be humanitarian assistance? Will you be helping all people who are on both sides of the barricades? Who have you already helped? Give us a little bit of assistance. And when there will be this humanitarian aid received?
Gives aid to all of those who are injured, those that stand on one side and on the other side of the barricades, as it may be.
Today we had 2 people from Red Cross, and they would be able to answer your questions about statistical information, how many people they assisted and what type of assistance they provide. Taras is here, and they will give you some data. As the Ukrainian World Congress, we help the Red Cross, but we do not assist people directly. So they will tell you about the data. We help with medicines, with the carriers, with the equipment for paramedical, and we help with the funds. We cover the transportation from regions to Kiev. And the second question is to psychological service of Maidan. What to do with people who suffered from Russian TV, actually, all of us receive letters where they say you are fascist, die, and they wish death to people, to their relatives, and these people who we know, and these are people who basically watch Russian TV, and they're psychologically basically wounded. What do we do with these people? That's the hatred which was inserted into their heads, just like a chip is inserted. That's the hatred which demands satisfaction, and that's the hatred that heats up everything that's happening in the East. Do we have any chances to rehabilitate these people? Thank you for this question. Many people come to us with this question, and we have two answers to this question. The first one, come to us, come for qualified support, because your reaction and the reaction of those people who react to that, that's a healthy reaction to abnormal events happening around us. Please come to us for support. And the second answer to that question now, we are being formed as civil society. We understand that there is an information war waged against us, and we should have our own position. We should have our own propaganda, and much depends on the journalists, what type of propaganda this will be. We should have this civil position which will not be ruined by some emotional attacks. Let's cooperate together. Let us start to work on that in mass media. We at Malopidvalna 4, and we will reflect this information attack together. Do you have any more questions? If you don't have any more questions, we would like to thank you. Thank you. We had U.Suprun, K.Waler, A.Myrgorodsky, Оксана Сивак, and N.Golembievska. Дуже дякую.
Ladies and gentlemen, our next guest speaker at 2 o'clock is going to be Vasyl Filipchuk, Chairman of the Board of the International Center for Policy Studies. Шановні колеги, наступний спікер буде о 2-й годині. Це Василь Філіпчук, голова Міжнародного центру перспективних досліджень, з темою виступу після референдуму «Чи є ще шанс для дипломатії?». Дякую, побачимось за декілька хвилин.